Nurses are the front line of patient care. We are the eyes, ears, and hands that monitor our patients' well-being. To provide the best care, we need a systematic approach. Structured assessments provide this framework. These assessments help us identify potential problems early on. They also ensure that we communicate effectively with other healthcare professionals. One such structured approach is the ABCDE framework. This acronym stands for Airway, Breathing, Circulation, Disability, and Exposure. Another vital tool is the SBAR communication framework. SBAR stands for Situation, Background, Assessment, and Recommendation. In this essay, we will delve into the ABCDE and SBAR frameworks. We will illustrate their application using a real-life scenario. Our patient is Mrs. Anita Jones, who recently underwent sebaceous cyst removal. By understanding these frameworks, nurses can provide safer and more effective care. Structured assessments are not just checklists, they are dynamic processes that require critical thinking. By mastering these tools, nurses can make a real difference in the lives of their patients. Vital signs readings include heart rate, blood pressure, respiratory rate, temperature, and oxygen saturation. These readings are crucial for monitoring patient stability and detecting any changes in their condition. The ABCDE assessment always begins with the airway. A patent airway is essential for life. Any obstruction can quickly become life-threatening. In Mrs. Jones's case, the first step is to ensure her airway is clear. We start by observing her. Is she speaking clearly? Is there any stridor, a high-pitched sound indicating airway narrowing? We also look for signs of cyanosis, a bluish discoloration of the skin. Cyanosis suggests inadequate oxygen levels. Next, we assess her breathing. We count her respiratory rate. We also observe the depth and pattern of her breathing. Is she using accessory muscles, such as those in her neck or chest, to breathe? This can indicate labored breathing. Any abnormalities in airway or breathing require immediate intervention. This might involve supplemental oxygen or even airway support. By addressing these issues promptly, we can prevent respiratory distress. Once we have established that Mrs. Jones's airway and breathing are stable, we move on to circulation. We check her pulse. Is it regular, strong, and within the normal range? We also measure her blood pressure. We examine her skin for signs of poor circulation. Is her skin warm and dry, or is it cold and clammy? We also look for pallor, a paleness that can indicate decreased blood flow. Next, we assess her level of consciousness. Is she alert and oriented to time, place, and person? We use the AVPU scale: alert, responds to voice, responds to pain, unresponsive. We also assess her pain level using a pain scale. Mrs. Jones might be experiencing pain at the surgical site. Throughout the assessment, we observe for any signs of anxiety or distress. These can manifest as restlessness, agitation, or changes in vital signs. By addressing these concerns promptly, we can enhance Mrs. Jones's comfort and well-being. Section 4. Exposure and news. 2. A comprehensive assessment. The final step in the ABCDE assessment is exposure. We need to examine Mrs. Jones's surgical site. We look for any signs of infection, such as redness, swelling, or discharge. We also check her temperature. At this stage, we document all our findings using the News 2 chart. News 2 stands for National Early Warning Score 2. It is a tool used to detect deteriorating patients. We record vital signs such as respiratory rate, oxygen saturation, temperature, blood pressure, heart rate, and level of consciousness. The News 2 score helps us to determine the severity of Mrs. Jones's condition. A higher score indicates a higher risk of deterioration. This allows us to escalate care if necessary. Section 5, the SBAR framework: effective communication for patient safety. Effective communication is crucial in healthcare. The SBAR framework provides a structured way to communicate patient information. This ensures that important details are not missed. Let's say we need to hand over Mrs. Jones's care to another nurse. Using SBAR, we would start with the situation. This is Mrs. Jones, post-op day 1 from sebaceous cyst removal. She is currently reporting pain at the surgical site. Next, we provide background information. The surgery was uneventful and she has no significant medical history. Then we move on to our assessment. Her vital signs are stable, but her pain level is 7 out of 10. Finally, we make a recommendation. I recommend administering pain relief as prescribed and monitoring her pain levels closely. By using SBAR, we ensure clear and concise communication. This helps to prevent misunderstandings and promotes patient safety. Section 6. Addressing patient concerns, anxiety and pain management. Mrs. Jones is likely to experience anxiety and pain after her surgery. It's our responsibility to address these concerns with empathy and professionalism. We can begin by explaining the post-operative process. We should answer her questions patiently and honestly. We can offer reassurance that her pain and discomfort are temporary. We should administer pain relief as prescribed and monitor its effectiveness regularly. We can also teach her relaxation techniques, such as deep breathing exercises. Building a rapport with Mrs. Jones is essential. Listening attentively to her concerns can help alleviate her anxiety. By providing emotional support, we contribute to her overall well-being. Section 7. Conclusion. Mastering assessments for optimal patient care. Structured assessments such as ABCDE and SBAR are not merely tasks on a checklist. They are essential tools that empower nurses to provide safe and effective care. By mastering these frameworks, we can identify potential problems early on, communicate effectively with colleagues, and advocate for our patients' needs. In Mrs. Jones's case, the ABCDE framework allows us to assess her airway, breathing, circulation, disability, and exposure systematically. The News 2 chart helps us to monitor her vital signs and detect any deterioration. The SBAR framework ensures clear and concise communication during handover, promoting patient safety. However, our care does not stop at physical assessments. Addressing Mrs. Jones's anxiety and pain is crucial for her overall well-being. By providing empathy, reassurance, and effective pain management, we can help her recover comfortably and confidently. As nurses, we are entrusted with our patients' lives. By embracing structured assessments and compassionate care, we can fulfill this responsibility with skill and dedication, making a real difference in the lives of those under our care.